Let's get the latest on the virus in our area with expert who's helped us through so much, Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you very much for your time tonight again on a Monday. We appreciate it.
Thanks for having me.
Back on January 1st, golly, it was rough. We were talking about 332 patients in your hospitals. Now we're at just over 100. We dipped below 100, I know it, for a little while over the weekend. What is going on here? Why are we seeing such a big drop in hospitalizations, do you think?
Well, you know, it really is what we've talked about. It's that post-Thanksgiving peak. We are certainly past that. We did not see the post-Christmas peak that we had planned for, which was great. We feel like people really adjusted their behavior around Christmas. You know, and we're kind of at that critical junction. If we keep doing the things that we're doing, we keep social distancing, masking, getting the vaccine, hopefully we can keep these numbers going down. If people see these lower numbers and let up, then we have the potential to go right back up.
And it's the same is true for new cases tonight. I mean, we had 0 new cases reported today in Johnson County. A couple counties in Southwest Virginia today, 0 new cases. Are we dealing with also a drop in testing? Is this a function of that as well, or have you been watching those numbers?
Yeah, I think in those raw numbers, you know, certainly if you've got a decrease in testing, your new cases will be lower, but that positivity rate is also coming down. So it does tell us that, you know, that the virus is actually decreasing in the area. The key is the positivity rate is still 15 to 17%. We want it below 5%, so we still have a long way to go.
15% of those tests are now coming back positive, and you want it down to 5. Thank you for reiterating that. I want to talk to you about the vaccine. We're talking thousands of people, several thousands of people in our area who've now been vaccinated both times. And we keep hearing about on that second dose for some people, they just feel like garbage, you know, for about a day or so, aches, pains, even a light fever, and then they feel fine after that. And this is anecdotal. I want to know, are you hearing some of that? And why are some people seeing that and others not?
Well, you know, we try to educate people as we give the vaccine. Those are expected and normal side effects. We are seeing that. We know that that's going to happen with this vaccine. Some people may not notice it. Some may have much more pronounced symptoms than others. You know, I think everyone's body responds a little different. We see that with other vaccines. So can't really answer the why it may be, but those are normal. And so we tell people not to worry. You know, you may run a fever, you may have a headache, you may have body aches. That's completely normal, and that's just your immune system starting to fight off what they're recognizing as those proteins, and that's what we want.
And if you don't have it, because a lot of people are not reacting at all, it doesn't mean the vaccine's not working. Is that true?
That's very true. So, you know, there's no indication that if you don't have this pronounced response that your vaccine is any less or didn't take as much. So certainly it's, you know, it's fine if you get it. It's normal, but it's nothing to worry about if you don't.
Jamie, I don't know about you, but this time of year, my family starts thinking, where can we go warm? Where can we go anywhere, you know, on spring break and on summer break, and starting to plan. A lot of people are wanting to get back to travel. If you have been vaccinated, is it okay to start planning that travel, and where do you stand on that tonight?
I think people just need to really think about where they're going to go. They need to look ahead. They need to look and see what the COVID positivity rate, what the numbers are in those regions. You know, CDC has some great travel advice, so things to consider when you're starting to plan to go somewhere, things to do when you get back. So I really would encourage you, as you're starting to travel, which I know many people will, to really just go check out some of those CDC tips as far as, you know, planning ahead, making sure you take your mask, good hand hygiene, trying to figure out, you know, are there things you can do without being in the midst of a crowd, and just take some of those things into consideration.
Finally, I want to talk to you about the variant strains that we keep hearing about. Dr. Anthony Fauci with the U.S. National Institute for Allergy and Infectious Disease today said that he expects the variants to become dominant soon. Have we seen any sign of those variant strains of COVID-19 in our region?
You know, right now, all the tests done in the region through us or through the health department test for COVID-19, but don't necessarily identify the variant. So the states are working to send so many specimens off to determine are any of them positive for the variant. So as we are able to get more specimens tested, we'll certainly stay in touch with our health departments, and I'm sure if and when the variant is here, we'll be able to share that. And
is it still your thought, as it was last time we spoke, that the vaccination is absolutely an effective defense against even the variants of COVID-19?
Right, there's still data coming out. It appears to be fairly effective, pretty good effective against the UK variant. It is somewhat effective against South African, maybe not as much, but we're still trying to understand the science of that. I think some of the companies are already looking at some changes if that's necessary to cover the variants, but absolutely, the vaccine is good. It's going to help at least some. It may not be that 95% protection against the variant, but it's going to provide some.
Jamie Swift with Ballad Health. We're loving seeing those numbers go down for your hospitalization rates. Thanks so much for the update and for all the work. We appreciate it. It's good to see you in that Super Bowl commercial last night, by the way. That was great.
Thank you.
All right.